Hello friends, welcome to PMT2 channel. In this video, we will discuss the research-based brand of Venus Remedies Limited, that is Neurotol. Friends, Neurotol contain mannitol and glycerol 10% each with added benefit of VRP011, which is used to reduce the intracranial pressure in traumatic brain injury patients. Friends, in this video, we will understand about the ICP, the causes of increased ICP, and the various treatment options used to reduce the increased ICP. Friends, when we break down the word intracranial pressure, intra means inside, cranial means skull, and pressure is the continuous physical force exerted on the brain by the skull. Friends, the normal range of intracranial pressure in adults is up to 15 millimeters of mercury, in children up to 7 millimeters of mercury, and in infants up to 5 millimeters of mercury. Friends, as we can see in this image, our brain is composed of three components, that is brain tissue, intravascular blood, and the cerebrospinal fluid. So friends, increase in any of these components will lead to the increase in the intracranial pressure. Friends, let's look at the different causes which are responsible for increased intracranial pressure, like cerebral edema. Cerebral edema leads to an increase in brain tissue volume due to conditions like traumatic brain injury, stroke, encephalitis, that is inflammation of brain, and meningitis, that is inflammation of meninges. Friends, lesions in the brain can also lead to an increase in brain tissue volume due to conditions like brain tumor, brain abscess, that is swelling in the brain, subdural hematoma, that is accumulation of blood below the dural membrane of the brain. Friends, increase in cerebrospinal fluid and the increased blood volume can also lead to the increase in ICP. Friends, we need to understand that after a head injury, it is very crucial to reduce the increased intracranial pressure within initial 3 to 8 hours, because when intracranial pressure increases and crosses the mean arterial pressure, then the brain can no longer receive enough blood and oxygen, and this condition is commonly known as ischemia, which in turn leads to the reduced heart rate, irregular respiration, and widened pulse pressure, that is, increase in the difference between systolic and diastolic blood pressure. Friends, as the pressure in the brain continues to rise, the brain stem may start to dysfunction and can completely cease breathing, which can also lead to death. Friends, the other symptoms of ICP include headache, vomiting, blurred vision, as well as changes in the behavior. Friends, the ICP can be managed by hyperventilation and elevation of head, but these ways do not effectively reduce the ICP. Moreover, friends, ICP can also be reduced by draining fluid using a medical indwelling device and through craniotomy, but these options are not safe and are rarely used. The most common and effective way of reducing the increased ICP is the intravenous use of osmotic diuretics like mannitol and glycerol, as they effectively remove the accumulated extra fluid from the brain tissues. So friends, in this video, we understood the concern of increased ICP in head injury patients. In next videos, we will understand the mechanism of action, role of Neurotol in reducing the increased ICP, and we will also understand that how Neurotol is better option than other osmotic diuretics products available in the market. So friends, thanks for watching and keeping your brain active while watching. Have a nice day.